Prospera, a company bringing common sense and simplicity to advanced wound care, committed to the maximum comfort and treatment of your patients, changing the way you think about negative pressure wound therapy. Prospera, advancing the art and science of NPWT. The concept of negative pressure wound therapy has been a valuable adjunctive approach to wound treatment for over 100 years. Today, several different pumps are available on the market, but they differ in many important ways that greatly affect you and your patients. To understand the differences requires a fresh, common-sense look at NPWT. At Prospera, we view wound care, and especially NPWT, as the place where art and science meet. Our pumps are engineered based on the latest science and the most sophisticated technology to provide clinicians with the flexibility and options they need to practice the art of wound healing based on their own clinical experience, knowledge, and craft.
Hi, I'm Cindy Ahern, Director of Clinical Services for Prospera. I've been a nurse for 30 years and doing wounds specifically for the last 16, but more importantly, I've been doing negative pressure for the last 10 years. I was very fortunate to be mentored by Dr. Charlie Baxter, who is world-renowned for his wound and burn work. There were some real strict guidelines when we set up the Prospera project. One of them, it had to be patient-focused. The patient had to come first. Secondly, it had to be nursing-friendly. We don't want to spend hours doing dressing changes and operating equipment, so it had to be something that was simple and easy to use. Thirdly, it had to be cost-effective, but more importantly, it was customizable throughout. The results of these efforts is the growing line of Prospera's negative pressure wound therapy pumps.
In NPWT, subatmospheric pressure is applied to the wound in a closed system. The system involves the use of a dressing and a flexible drain, sealed with an adhesive film that is connected to a programmable pump, which, through controlled suction, creates a vacuum. This provides for a uniform negative pressure across the wound bed. This uniform pressure is the key to understanding NPWT, not the dressing medium. Many questions about NPWT remain to be answered through ongoing research. However, 3 leading mechanisms of action are thought to contribute to the wound healing benefits of NPWT therapy. The removal of excess exudate is the first mechanism. The fluid removed contains microorganisms, debris, proteolytic enzymes, and other components which can prolong inflammation and edema and delay healing. Removal of this exudate results in antimicrobial control and maintenance of a moist environment important for healing. The second mechanism of action is the reduction of interstitial fluid in the wound. This reduces edema, which decompresses the tissues. As a result, capillary blood flow is increased, allowing for improved perfusion, angiogenesis, and increased supplies of oxygen, infection-fighting cells, nutrients, and growth factors important for healing. The third mechanism is related to the exertion of mechanical stress and a pressure gradient across tissue that results in surges of blood flow, cell growth, and proliferation to the wound area. In addition, the physical strain on cells stimulates them to interact with soluble growth factors in the extracellular matrix. This is often referred to as cell stretch. The stretched cells begin proliferating, dividing, and maturing, leading to the growth of new vessels, collagen deposition, and granulation tissue formation. Once the wound is filled with healthy, new granulation tissue, negative pressure should be discontinued and standard dressings can be used. Recent studies in NPWT have examined microvascular blood flow at varying levels of negative pressure and for varying duration. Researchers at the Lund University Hospital in Sweden used laser Doppler technology in 2 pig wound models to conduct a detailed analysis of microvascular blood flow at varying distances from the wound edge and in different tissue types. In their studies, increased blood flow was observed in tissue immediately surrounding the wound edge. However, a zone of hypoperfusion with reduced blood flow was also seen. When higher negative pressures were applied, the zone of hypoperfusion increased, causing greater concern of ischemia, an insufficient supply of oxygenated blood, which can lead to tissue death. For optimal wound healing, a balance is needed between adequately increasing blood flow while reducing edema and minimizing possible ischemia. The Lund authors propose pressures of minus 75 millimeters of mercury for subcutaneous tissue and minus 100 millimeters of mercury for muscular tissue.